Hi, this is Mrs. Anderson, and welcome to week 2 of veterinary science. This week we're going to be focusing on biosecurity. We begin by looking at common signs and symptoms of diseases. We'll look at modes of transmission, zoonosis, and wrap it up with being able to identify sick versus healthy animals. So let's get started with common signs and symptoms of diseases. One of the things we're always concerned about is the transmission of diseases. How do they get spread? So sometimes it's through contact, skin to skin. It might be saliva, like in the case of rabies, somebody gets bit, or other examples could include inhaling the disease or ingesting it, meaning taking it into your stomach. So once an animal has made contact with the virus or disease, begins to show symptoms, which are abnormal measurements or behavior of an animal. Examples might be a fever above its normal body temperature. Vomiting, diarrhea, I think are pretty self-explanatory. Lethargy means it's sort of lazy or sleepy, or maybe it just looks depressed. It's just not its normal energetic self. Anorexic means that it quits eating, and I had to look this last one up. Dyspneic means that an animal is having difficulty breathing. Signs are those things that are measurable and objective changes in bodily functions that indicate the existence of a disease or disorder. Things like a rise in temperature. A change in pulse can often be used to determine whether an animal is in pain. Its respiration rate, how many breaths per minute are normal, and if it is in stress, it's going to be breathing heavier or faster than that. And of course, again, diarrhea or loose stools. Prognosis is a word that we use to describe a prediction about how the disease will develop. What is the prognosis for this animal? It will lead to kidney failure, or it could lead to liver failure. Pneumonia means that could lead to death, or it could be a full recovery. We always are hoping for a full recovery prognosis, and of course any of the others are life-threatening. The diagnosis is that step of actually determining the type of disease based on physical exams and diagnostic tests. Now, the problem is this. Physical symptoms can be similar for many different diseases. For example, vomiting or diarrhea could be a symptom of a bacterial infection in your gut, but it could also be a symptom of other diseases as well. Treatment is the term we use to describe the medical care and or therapy used to prevent further infection or to be rid of the disease. So animals are treated with medications or prescriptions. A change in diet sometimes can control your pet's blood sugar or things like that if it were to become diabetic. Administration of fluids. We once had a cat who was severely dehydrated, and simply by injecting a pint, I believe it was, of saline solution with a needle subcutaneously or under the cat's skin between its shoulder blades was enough to restore that cat to full hydration and restored a lot of its bodily functions. And of course, finally, a last option is always to go for surgery. Surgery has its own risks, and we try to avoid that when we can. Finally, an ounce of prevention is worth a pound of cure, my grandmother used to always say. Prevention are those measures that we take to eliminate a possible infection in the future. So most good animal producers understand the value of vaccinations for their animals to prevent disease and deworming their animals to prevent worms and parasites, internal parasites, from stealing the nutrition from their animals. So there you have it, folks. Common terminology used in discussing the transmission of diseases.